എല്ലാ വനിതകൾക്കും സെറ്റാഫിലിന്റെ വനിതാ ദിനാശംസകൾ.
Cetaphil greets all women folk a happy International Women's Day. The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
With our stunning collection of fine jewelry, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al Siraj Jewelry, our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 33542530.
എല്ലാ വനിതകൾക്കും സെറ്റാഫിലിന്റെ വനിതാ ദിനാശംസകൾ.
Good evening, viewers. Welcome to yet another episode of BMC Global Live Alhilal Health World. Nothing but lifestyle. This is a health-based talk show where all your health-related queries and concerns are answered by expert doctors. Good bowel moments are very essential for the general well-being of the child. Today's topic of discussion is constipation in children. And we have with us Dr Abuzer Surka, the consultant pediatrician and the head of pediatrics department in Alhilal Hospital. He comes with a wealth of experience, 27 years, 17 years in India and 10 years in the Middle East, and he has over 25 years of expertise in treating different kinds of allergies. We are delighted to have him with us today. He has also attended various reputed international conferences in India, the US, Europe and the Middle East. To name a few, American Academy of Pediatrics, SFIGN and Nutrition and Growth. Thank you for joining us, Doctor.
Thank you so much. My pleasure.
Can we begin by defining what exactly is constipation? Because many parents are a bit confused about this. So if you could just tell us in medical terms, what exactly is constipation?
That's a very important question, and I will try to make it very simple in more simpler terms. The definition of constipation in children varies according to the age of the child. For example, the child with 6 months or less of age, for that child, the passage of stool every 3 to 4 days is considered to be normal. More important is the consistency of the stool. The stool should be soft and like a normal stool and normal in color. So, if the child passes every 3 to 4 days, a baby less than 6 months of age, it is considered to be normal. There is no need to worry. On the 5th day, if still there is a problem, they can consult the doctor. Then comes the age beyond 1 year of age. For that 1 to 4 years of age, the passage of stool, the frequency should be not less than 3 times a week. So, it should be at least 4-5 times a week. If it is 3 or less than 3 times a week, it means the child is constipated. You need to take medical help. And lastly, 4 years and above, the frequency comes down to 2 or less per week. So, if it is, it should be more than 2 times a week. If it is less than 2 times a week, it means that the child is having some problem. We need to give attention to the child's health and we need to solve the problem. So, this is how we define constipation in children. So, even for sometimes parents are very much anxious, especially small babies, not passing stool for 1 or 2 days. They rush to the doctor and they give unnecessary medications. So, especially I would focus on the younger babies like less than 6 months of age. Do not give unnecessary medications. Wait for at least 3 days and the child will pass the stool normally. Even then, if there are any other symptoms, you can always consult the doctor.
Okay. And what are the common causes of constipation? What do you think causes constipation in children?
You will be surprised to know that constipation or failure of passage of stool, which we say, or even to be more precise, it is called difficulty in passage of stool. The causes are most of the time it is like functional. Functional means there is no other organic cause or organic disease in the body. All the organs are normal. It is a functional constipation, what we tell. Functional means it is due to factors other than any sort of diseases, and less than 20% of cases are due to some particularly major disease in the body. So, I would like to today focus more on the functional part, and then we will name a few diseases which could be there, but we do not want to make the parents anxious or panic, because most of the cases they actually resolve spontaneously by proper medical advice, by proper care regarding the food and the diet of the child, and by increasing or by training the child for the bowel habits.
So, do you think there is any correlation between the diet and constipation? Is there any particular food that the kids should avoid to prevent constipation, or anything which promotes good bowel moments in kids?
See, there is no particular food, all normal food which you eat, but very important for diet is very important. When does constipation occur more commonly in the children? That is when they get inadequate fiber intake. Now, from where do we get the fiber? As we all know, more from the fruits and vegetables, we get enough amount of fiber. And nowadays, I see in my clinic, many parents complain that the child doesn't take, sort of enough amount of fruits and vegetables. Yes. They are more into junk food. And this is the one of the culprits for causing irregular bowel movements. Okay. Second important thing is inadequate fluid or water intake. That is also very important, and now we are going to enter summer. So, again we should keep in mind that a child gets adequate liquid intake during the daytime, because less liquid intake will cause the stools to become hard in the bowel, and then the stool will not pass out easily. So, we need to give adequate fluid intake, at least 5 to 6 glasses per day of water, or plus other liquids like vegetable soups, which will also help to contain the fiber. Avoid too many sugary drinks, but you can stick to these 2 points. Mainly plain water, adequate amount is very important to ensure smooth bowel movement. Regarding the food and diet, and also regarding physical activity. I mean, you may be surprised that because of the COVID-19 pandemic, one of the most silent diseases which we have seen, where people don't talk about much, but we have seen very commonly in our clinics, is the irregular bowel movements in the children, because their physical activity has been substantially reduced. They were mostly confined indoors, only online classes, not going to school. So, the physical activity became almost near to nil, and because of lack of physical activity, the bowel will not have regular movements, and the child needs to have proper physical activity, which is very important also. Many parents miss this point, and this is very important to ensure proper bowel movement.
So basically a fiber rich diet, lot of water intake and adequate physical activity.
These 3 points, if they keep in mind, the parents, it will solve most of the cases of constipation.
And are there any specific tests to diagnose constipation?
So, as I told you, that majority of the cases, like 75 to 80% are due to functional constipation. So, for that, the clinician, the doctor, has to take a proper medical history, proper diet history, and also regarding the lifestyle of the child. This is very important. Now, in this I would like to add one more point, is the way the parents deal with the child in such situations. I have seen many times the parents, especially mother, also because of her other stresses, she gets angry with the child not passing the stool. Then the child develops the stress and the fear. Secondly, the child himself has got the problem, like when, because of hard stool, the stool passage will be sometimes painful for the child. So, the child starts holding back the stool. They will not like that entire process of going to the toilet. So, then the child will hold back the stool, will not pass the stool, and this will lead to a vicious cycle. The stool amount will start increasing in the bowel, it will become more hard, and it will get impacted. Impacted means it will get blocked somewhere in the bowel, and then it will not come out easily. So, these things the parents have to reassure the child, talk softly with the child, do not get angry. Most of the cases child does not do it purposefully. There is some problem with the child, and that is why we need to be very soft and gentle to the child. Don't make the entire experience stressful for the child. Make it or you can sometimes divert the child's attention in the potty. You can, when younger children, and try that the child does not have any sort of psychological stress of the entire process. This is also very important part, and this also is a very common cause of constipation.
And what are the red flags that the parents should look out for? Like, how can you differentiate between chronic constipation and normal constipation which may occur occasionally?
See, what do we mean by chronic? Chronic means it is recurring for a long period of time, and also it is recurring again and again. So, these things when happen, again the first things, because first look for the common things. That is my always advice to my patients. Look for the common things. So, look out for diet, liquid, the psychological factors. Then the red flags come. The red flags means that the child is losing weight, the child's stomach is getting distended, the child is not keeping well, getting cranky, not eating well, and maybe sometimes fever also. This all should point towards some organic cause, like some disease process is there, and then we need to investigate further to find out the organic cause, what there is some particular disease. But first we need to rule out the psychological causes and the functional causes. That is the first step, because this sort of investigations come into play later on, when the child does not respond to a normal interventions like proper food, proper liquid. Then we have to think of certain like diseases in the bowel, and then we have to investigate. We do investigate further, and we come to a diagnosis. Then we give the proper treatment for that condition, and the child is completely cured of the condition.
So, what are the common diseases associated with constipation?
The common diseases, there are certain, like there may be some endocrinal disorders like thyroid disorders and parathyroid disorders. When the thyroid levels are low or parathyroid hormone levels are low, the child may have difficulty in passage of stool, because the bowel movements will become sluggish. Then there come certain localized diseases of the bowel itself. In that, they are most common disease which we see in the newborn period. Now, I would like to particularly give some information on this disease. It is called Hirschsprung disease. Hirschsprung disease means there is some neuromuscular disorder on the bowel, and this is seen in the first 48 hours of age. Like if the newborn baby doesn't pass stool, which is called as meconium, the greenish stool, the first stool that the baby passes, should pass within the first 48 hours, all babies normally. But within 48 hours, if there is no stool output, the stool doesn't come at all, there is no meconium passage, means that the bowel is not functioning normally. The bowel has a problem, so we need to investigate, and we investigate by doing a biopsy and a nanometry. Nanometry means we do the electrophysiological study of the bowel. Now, what is Hirschsprung disease? In short, I would like to give information that it is a neuromuscular disorder in which the bowel muscles, we have got muscles in the bowel which are smooth muscles which help to propel the bowel contents outside the body. These muscles, they have certain segments, have nerve cells missing. This is from birth. There are no nerve cells, they are without nerve cells. So, when we know that our body functions because of the nerves, we get a signal from the brain, the nerves give the signal to the muscles and the muscles start functioning. Same way it is for the bowel. Even if there are no nerve cells, there is no signal from the brain to that bowel. Bowel will not function, it will not push the bowel content out, it will not push the meconium out. And then we should consider it is a very serious condition, because if we do not look into it immediately, the bowel will be getting bigger and bigger, obviously because of the stool content inside, and it may even sometimes lead to death of the baby. So, we need to immediately consult a pediatric gastroenterologist and do the proper procedures like nanometry and a biopsy and reach the diagnosis, and then it is patients babies may need to go for a surgery to cure this problem.
Okay, so the first 48 hours after the child is born, it's very important they pass that green color.
Green colored meconium stool, yeah. Then other conditions apart from this localized are very rare conditions. There are some neuromuscular disorders like cerebral palsy and all, because in which the entire nerves and the muscles of the body are weak. So, similarly it applies to the bowel muscles also. There may be some rectal stenosis. Stenosis means that the opening of the bowel, that anus opening, it is very small or it is sometimes absent in the children. And then how will the baby pass the stool? So, all these conditions usually be diagnosed within the newborn period only. Mainly thyroid disorders may sometimes present late, because thyroid disorders do not have any specific symptoms in the earlier stage of life, and then when the child has got recurrent constipation, or there are other symptoms like the child is lethargic, clumsy, they are particularly the face of the child of hypothyroidism, then we need to investigate, and then if the child's thyroid hormones are found to be low, we give the medication and the problem is solved.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
And doctor, we have a query from one of our viewers, and she's written her 1-month-old baby has irregular bowels and she cries too often. So, is it okay to give any medication for constipation at such a young age?
This is a very common scenario we find in our clinics, because small babies, they do not speak or they tell anything, they just keep on crying, and the parents are obviously worried. So, as I told you earlier that babies of 1 month of age, we should wait for 4 to 5 days, and then gradually the bowel movements becomes regular, then the baby starts passing stool daily. Few babies have this problem. Secondly, we should look for the disorder, as I told you, like in the first 48 hours they are not passage of stool, then immediately you seek some medical attention. Then thirdly, there may be some gas and colic. So, another important advice is regarding the feeding, I would like to stress here, that first of all, breastfeeding is the best for the child. So mothers should try to give as much as possible breastfeeding. Don't switch over to formula feeds unnecessarily. Only if there is some valid reason you go for the formula feed. Otherwise, we always encourage that baby should get the mother's milk as much as possible. Secondly, that the baby should be burped properly. Burping is very important, and many times I have seen the mothers that once the burping sound comes after 5 or 6 minutes, they just make the baby lie down. I advise that try to do burping more beyond that, like 15 minutes or more, so that the baby's digestion process will become much more stronger. Baby will have normal bowel. Don't rush for medications in such small babies, because babies, the problem is usually transient. It is mainly because of the baby adjusting to the mother's milk or the milk, formula milk. There are special formula milks available for constipation, but I would not recommend them, because mother's milk is the best thing that God has given for the baby, and it is the solution for all the problems. Just be patient, because the baby's bowel is getting adjusted to some new type of food. Baby has not taken anything before, so that food and digestion, it takes time to adjust. Not in all the babies, but those babies who have this problem, I reassure my patients, advise them, and even then if anything is there, they can always contact us. We are there for them. But medications in small babies is not the first priority.
Can avoid it as much as possible and stick to breast milk and make sure that they burp
Burping
quite often. These three things have to be kept in mind. And what about kids above the age of 10 years? You know, let's say they have recurring abdominal pain. Could constipation be a cause of that? And if that's the case, how do we go about it?
Yeah, constipation could be one of the cause of recurring abdominal pain also, and sometimes severe abdominal pain. I have seen patients come to the emergency in the middle of the night, and like elder children, more than 10 years, 12 years old, and they have severe, I mean, excruciating abdominal pain, and we first think of some surgical emergency, maybe some appendicitis or something, but it turns out to be constipation. The child is not passed for 3-4 days and stool has got impacted, as I told you. It has blocked somewhere in the bowel, and that blockage can cause sometimes very severe abdominal pain. And after we have to rule out, first of all the surgical emergencies. If all the reports, investigation are normal, think of this also as a cause and give some enema and some medication. And once the stool is passed, the baby becomes very relaxed, child becomes very relaxed, pain goes away.
So doctor, can you just sum up for us, you know, what are the normal guidelines that the parents have to follow? Because as you know, it can be, it can cause a lot of distress to the parents and the kids. It can be a nightmare for both of them if their bowel movements are constipated.
Yes, I would first like to thank you that you took up this topic today. This is a very common but very less talked about topic. It is very commonly we see in practice, and parents are most of the time distressed about it because they feel helpless what to do. So again, I will just summarize this thing, that according to the age of the child is a small baby, less than 6 months of age. If the child is feeding well, child is active, alert, only problem is that the child passes stool every 3-4 days. Don't worry, it is normal. Gradually, the bowel pattern will become normal, like daily 1 stool per day. More important is that a child should be feeding well, child stool consistency should be normal, child should be looking active, alert, playing well. Then there is no need to worry. If such things are not there, are any other associated symptoms, child is not feeding well, there is some abdominal distension, that tummy looks very big, or the child is feeling lethargic, not active, then you should immediately consult a doctor, pediatrician who is experienced in such condition, so that he can advise you properly. Going to the older age, as I told, that bowel movements less than 2 or 3 times a week should be a cause of concern. So immediately consult a doctor. He will advise you about, first of all, the functional causes, proper fiber intake, proper liquid intake, and proper physical activity. These 3 things keep in mind. Solve this and make it normal, the problem will go away. Still it does not go away, then there are some medications which you can use in the older children. And lastly, as I told you, still older children, like above 4 years age, then the mother should also consider the same factors. Along with that, there is some sudden emergency, sudden abdominal pain. Also, we have to keep in mind constipation if the child has not passed the stool normally for 3 to 4 days, and we need to seek medical attention.
Thank you so much, doctor, for those tips and advice on how to tackle constipation and how to handle it. Parents, in case you have any health related queries about your children, feel free to consult Dr Abuzer Surka, who works as a pediatrician and the head of pediatric department in Alhilal Mohrak. A healthy child is a happy child, and a happy child means happy parents. So parents and children, wishing you loads of happiness and good health always. This is Anupama signing off. Till we meet again next time, stay safe and take care.
എല്ലാ വനിതകൾക്കും സെറ്റാഫിലിന്റെ വനിതാ ദിനാശംസകൾ.
Cetaphil greets all women folk a happy International Women's Day. The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
With our stunning collection of fine jewellery, gemstones, pearls and diamonds, fine pieces in timeless designs and unspoken elegance. Al-Siraj Jewellery, our story, our pride.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com. Since 2006, Magnum Imprint have been offering high standards of quality with our professional team that delivers all your advertising and promotional requirements efficiently and promptly. For more details, please contact 39887088 or 33856330 or 3354